You are listening to NSR, National Scrubs Radio, where nurses, doctors, students, and other healthcare professionals bring you stories from scrubs across the nation. Tune in today with NSR's Derek J.
So welcome to NSR, that's National Scrubs Radio. This is your host, Derek J. When I started NSR, I was thinking of topics, and one of the things that really popped up and stuck out to me was, I was thinking, what happens when us, the ones that wear scrubs on a daily basis, or maybe we used to wear scrubs, what happens when we become one of them, the patients? So I was thinking like, oh my gosh, here we go, when we become patients. So I was throwing this idea out with some friends or in the industry, and I said, I had this idea, and they said, hey, you got to meet Kari. So we met. So Kari's an ICU nurse that is a stroke survivor. She was diagnosed with protein C deficiency and unfortunately had her stroke while she was visiting the Grand Canyon. Her friend that was with her, Jamie, is a nurse too, so fortunately she was there to recognize the signs and symptoms of a stroke. And Kari tells her story. She talks about coping with, the denial. Like, is this really happening to me? I'm so used to taking care of other people. Why is this happening to me? She even explores through her hallucinations, one involving Seth Rogen and a Sprite. You have to listen to that. Also, Kari suffers from seizures now, and she goes through her experiences of what it's like to go through one and how it feels to wake up. We even tried to do this interview a few times, and one time she goes, hey, I had a seizure this morning, had a fall, I'm on medications, and I'm just too tired to do this right now. But Kari was very brave. I kind of walked out of this interview thinking, I'm not sure if I could be this brave to tell my story like this, and I appreciate you, Kari. Here's Kari's story.
Hi, my name is Kari, and I'm a stroke survivor. When I was 28 years old, I suffered from a stroke. Well, I didn't exactly suffer. I didn't know it was happening at all. It was in the middle of the night while I was drifting in and out of sleep. I woke up and realized I couldn't move. And I asked my friend Jamie, who is also a nurse, to help me stand up to go to the bathroom. And she came over and she said, Kari, you're not moving your left side. And I thought, okay, this girl is out of her mind. There's no way. And then she asked me to smile, and she said, okay, your face is drooping. So I smiled harder and lifted my head to fake that there was no droop. And she said, okay, Kari, I think that this is going to be a stroke. And I knew exactly all those symptoms for sure that it was a stroke. So she called 911, and initially I was really upset because then it confirmed that I probably really was sick. And then when the ambulance came, the paramedic came to me and he looked to his partner and he said, oh, she's flaccid. And I was really upset because it's like, okay, I don't know what's wrong with your insecurities, but there's nothing flaccid about me. And so the nurse came as well, and he tried to explain to me the symptoms of a stroke and what this meant. And I rolled my eyes and just thought, oh, this is ridiculous. Like, I already know the answer to all these things. I just kind of doubled over and told myself, this isn't happening. This isn't happening. Only other people get this. But my pride was showing. I had already decided in my mind. I crossed the line in the sand, and I thought, on the other side of the line where people took care of it, sick people, other people, and on my side of the line were people who took care of those sick people like me who were invincible.
Thank you so much, Kari, for sharing that. That's really hard for even me to take in right now. I can't imagine. It's almost like being speechless, because like, what do you say to that? I'm sure you've had friends who try to, like, what do you say to your friend that's going through all of this? How did you handle, like, what happened after you went to the hospital? Like, what were the next stages for you while you were inside the hospital?
In the first hospital I went to, because it was a really small rural town. The hospital only had one nurse working and no CT machine. They couldn't help me, and so they had to call a life flight to send me to Phoenix, where a hospital could actually take care of me. And the whole time, I was really upset about the care I was getting because one nurse promised me that I could go to the bathroom, and then they got me on the plane, and so I tried to pee, and they said, "No, you can't do that." And I said, "No, the other nurse promised me."
Right.
And the whole time I was still in denial, and I think I was crying and talking to my friend Jamie, who came along, and I asked her to call everybody in my family, and she said, "Okay, your sister is in another country." I said, "I don't care. I need you to call her and leave a voicemail.
Right.
Because this isn't happening and all these people are out of their mind. You need to come and fix it." And I was really just in denial and upset, and I took it out on all the healthcare workers who took care of me. And it took 6 hours before they got me to a hospital who could take care of me. And by that point, they found that I had a huge stroke, but I was out of the window for TPA. At that point, they admitted me to the ICU, and I couldn't really understand what was happening. It was all fuzzy, and I could hear people talking, and I wanted to speak to them, and they kept asking me questions like to open my eyes, and I knew what that meant, but I couldn't open them. They asked me to move my toes and to lift my legs, and I just couldn't do it. And I thought, maybe I was tired. Maybe I was just still sleeping. And I was just thinking, this is a big cosmic joke, and this is going to be a funny story that Jamie and I were going to laugh over Bloody Marys the next morning.
So your mind was still there, but you just had no control of your body.
Yeah, I knew mostly what was happening. I could hear people talking. For example, I heard them talking bad about me.
What were some of the things that you heard?
Things like my parents just said, this is what happens because of her, her lifestyle. She's always going around and working too much. And I heard a doctor tell them that because I hadn't been eating, I needed a feeding tube. And I was really upset about that. But because I was fighting so much, 4 people had to hold me down while they put it in. It was incredibly uncomfortable. And so they started giving me the feeding tube, and they gave me Jevity, which gives you the worst diarrhea in the world. And it's painful. It's awful. So if you have to give it to your patients, understand how uncomfortable it'll be for them and how cleanup is really raw and just.
Yeah. I can't imagine being in that situation. And you said at one point you were just fighting a little bit, like just kind of, did they ever put you in restraints?
I was in 4-point restraints and a posy vest.
Oh, wow. But you were in 4 points.
Yes.
Not just the soft wrist.
Yeah.
So you must have been fighting pretty hard then.
Yes, I was.
Yeah.
Because I was in full denial about what was happening. So I thought, I'm going to run away from here because none of these people know what's really going on. And I kept trying to escape and wiggle my way out of the restraints.
So people had to sit with you at all times?
Yes, because I was fighting all the nurses and all the doctors who came to help me. I was just really upset that this was happening, and I wanted to escape the room and escape my bed and just pull out all my tubes. And I could hear all the monitors beeping, and I just wanted to turn around and look at them and try to be the nurse in the room, telling my nurses how to run their drips. And when I was intubated, they tried to explain to me what was happening. And instead of imagining it happening to me, I imagined it happening to another patient.
So it was like you were trying to regain control of something that happened to you. It was you had no control of. Is that right?
Yes.
And especially being an ICU nurse, you knew everything that was in that room.
Yes, and since I was in the bed and couldn't do those things myself, I was so focused on it in my head and thinking about every step that was being done. And so, since I couldn't do it, I started telling the nurses how to do it, telling them what kind of medications I needed, telling them how to run the drips. Even though I knew it was their job, I wanted to make sure the care that was given to me was the way I would have given it to a patient.
Do you feel that the care that you received was different than what you would give a patient?
Yes, I did.
Can you elaborate on that? In what ways?
For example, one thing is nobody was really explaining things to me. I would just be touched in different ways. For example, they were trying to give me a suppository and they didn't explain that they were doing it. It was kind of a surprise. And so I was squirming and trying to fight them. And all they said was, well, Kari, you know this has to happen. But I said, okay, well, I understand it has to happen, but give me a warning. It's kind of an invasive situation.
Yeah, I mean, that's definitely that's definitely something that's close to your body, and it is your body, right?
Yeah.
So you would hopefully someone would explain that, hey, we're about to put my finger up your butt, right?
Yeah.
I mean, really, that's really what that is.
Yeah.
For medical reasons. But in what other ways did you feel, that the care was not up to par?
I felt definitely ignored. For example, there was never a call light near me, and nurses never rounded on me. And so I felt ignored and just that if anything wrong happened to me, nobody would take care of me. And I was intubated, so I couldn't call for help. So that's the biggest thing why I tried to get out of bed.
So you try to get out of bed while you were intubated and still, tubes in you and everything else?
Yeah. So I just ignored all the tubes and pulled on my restraints and tried to wiggle my way in between the bed rails.
Mm-hmm.
And so in order to get attention, I pulled off my leads.
Because that would make the alarms go off,
yeah, so
right?
the alarms would go off.
Yeah.
And then later on, nobody came, so I took my pillows and threw them on the floor so the bed alarms would go off. Because I just felt so solitary. And I remember the patient across the hall from me would just yell at night, saying, somebody help me, something's wrong, somebody help me. Nobody would come help him. And there were no call lights available for us to use. And so the patient stood up from his chair and fell.
Mm. That's sometimes that's how falls happen, right?
Yes, definitely.
Yeah.
And I knew it was wrong to try to get out of bed, but that's all I was so focused on doing. And I got one leg through the bed rails.
You were sneaky. You were like a little wiggle worm just trying to get through there, huh?
Yeah, I was one of those the bad patients I used to hate.
And now you're one of them.
Yeah, definitely.
But I mean, you're explaining your reasons for that, which, I can't imagine, right? Being in that situation. Did you, besides pulling on your restraints, did you try to do anything else that was bad?
I tried pulling out my feeding tube. I was stopped, though, by my brother who was in the room.
Oh.
He grabbed my hand.
So they got one of them family sitters on you.
Yeah. Which I was really mad about because they should have been on my side.
Right.
But everyone stayed and watched me and tried to stop me from getting out. But I remember working with my patients and always thinking, what are these people thinking? Why are they wiggling so much? Where do they think they're going?
Right.
And now in that position, I understood what they were thinking.
Did you ever try to extubate yourself?
Yes, I did. So after my surgery, I really wanted to get up and get a Sprite because I was so thirsty. So I wanted to take the tube out, but knowing I couldn't just pull it out without ruining my vocal cords, I had to deflate the first.
You already knew ahead of the time because you're so used to doing this for your job.
Yes.
All this, right? Okay.
And so I knew what I needed to have done. And so I knew I needed a syringe to deflate the cuff. but I couldn't find one lying around. And I tried to look at nurses' scrubs to pull one out of their pockets.
You're sneaky. I mean, I get that. I mean, wow. That's pretty focused. How were you successful or at any point like pretty close to grabbing a syringe?
No, I never saw them in the nurses' pockets. And then I was upset. I was like, how could you not have a flesh at least in your pocket?
Yeah.
So I never succeeded.
Yeah.
And I never got that Sprite either. So instead, they dipped sponges in water to try to moisten my mouth.
Mm-hmm.
And that just would not quench my thirst. And all I could think of was the only thing that would help me was a bottle of Sprite.
Right.
And so I tried bribing people to get them to get me Sprite because I thought that was the only thing that would help me. And then I started dreaming or hallucinating about things happening. I dreamt that I was in the hallway and I saw a vending machine and I thought I saw Seth Rogen.
Seth Rogen? Okay.
And so I asked him for $1 so I could buy my own Sprite. And then instead I said, because then I thought, okay, this is going to be really bad PR for him not to help a sick person.
Right.
So then I said, can you give me $1 and will you sign it too? Because I'd like your autograph.
So you must be a Seth Rogen fan if he's...
Oh, I love him.
Yeah, if he's happening your hallucinations, definitely, for sure.
And then Seth Rogen started walking towards me to shake my hand. And I knew it was my brother's hand because I'm very familiar with his handshakes.
Oh, okay.
And then I was just really disappointed because I didn't get the Sprite or the autograph. So then they took me back to my room.
So after that happened, those green sponges, how were those for you?
Oh, they were horrible. And I remember giving them to my patients all the time.
Yeah.
But instead they feel like just sucking on plastic.
Right.
And it just sucking on like latex, like a balloon.
Right.
And somewhat like just sucking on a condom.
Well, I appreciate you being honest. Yeah. I mean, those are the thoughts that you're going through your head.
Yes.
During that time, right?
And I was very vocal about it.
So like you were saying this in front of family.
Yes.
Stuff that people probably maybe not heard you say before. Would you say that, or are you?
Yes.
Okay. Because I don't know if you would normally say that in front of family or not, but apparently sometimes after a stroke you might say certain things that people might scratch their head on.
I definitely said really inappropriate things. I said that I called my diapers my chastity belts.
Okay.
When they made me wear those mesh panties.
Right.
And so then I had them write Victoria's Secret on the band.
On the band of mesh. That's how.
So then I would feel more normal, and I would tell, for example, the CNAs, like, let's make this look good because I have a boy waiting at home.
Right. That's awesome. So, do you remember the feelings of going through the stroke, or was there a gray period or a period you don't remember during this whole process?
There was definitely a whole period that I didn't remember. Days would go by and I had no way to remember what was happening. For example, when they did their neuro checks, and asked me where I was and what day it was, I definitely didn't know what day it was. I would have moments, for example, like I thought a goat was trying to kill me. And so I called my friend in the room and I said, I have a shotgun at home. Can you get it? Because I'm going to kill this goat. And then I thought, wait a minute, talking like this, they're going to send me to psych.
Right.
So then I went back to sleep just in case somebody heard me.
You were afraid that you were going to have a psych consult after all this.
Yes.
Because you wanted to kill a goat.
Yes. I was saying nonsensical things and asking for a shotgun. Then I really thought, okay, they're going to think I'm depressed and want to kill them or myself.
Right. So you were afraid of the whole suicide questionnaire that we were used to saying. And those were your fears in those certain times. You're like, I got to hush. I can't say this because I might be in trouble.
I still had in the back of my mind what it was like to be a nurse and how to take care of somebody going through this. If they were saying this kind of information, what I would do, I would tell the doctor about it, and we would consider maybe antidepressants. And actually, I asked for my own antidepressants.
ahead of time,
ahead of time. Yes.
knowing this.
Yes.
So through this process now, what medications are you currently on? After this whole hospital stay and where you're at now, what kind of medications are you on now?
Most of my medications are targeted towards anticonvulsants.
Okay. So did you have seizures right after your stroke, or was it down the road?
About 5 months after I was discharged, I had my first seizure.
Wow. And how often do you have those seizures?
Once a month.
Once a month? And
Yeah.
can you describe how it is to go through a seizure? I mean, I can't imagine. Do you remember it? Are you awake consciously?
Yes, I'm conscious through the whole event. Even including my grand mal seizures, I'm awake through it. And it's the most frightening experience of my life.
Wow.
For example, my head starts jerking
Mm-hmm.
one way as if it's going to turn all the way around. And I can't talk or call for help. And then because my head is twisting, I feel my diaphragm twisting as well. Or convulse. And so I can't breathe. And I feel like I'm going to die. And when people help me lie down, I feel like I'm going to fall through the floor.
Because you have no control of that motion of being laying down,
Yeah, and I have no proprioception at all. So I don't really know what's happening. I always feel like I'm falling off the bed. Or I always felt like I'm dying through the whole experience.
And afterwards, I'm sure, are completely exhausted. I mean, I hear that's pretty common with seizures, that you consume a lot of energy, a lot of oxygen, that kind of thing. So the medications, do you have any side effects with any of the medications that you're on currently?
The most significant side effect is some of my medications, in order to help with my seizures, the dose I have to take makes me it's close to being toxic for my body. And once I was hospitalized for it, they considered it an accidental overdose.
And what was the side effect of the overdose? Like, what were your symptoms?
The first symptoms were loss of balance. I couldn't walk at all because at that point I was walking with a cane. And with the toxicity, I would stand and fall over. And I just couldn't walk even with assistance. So that was the first time I knew something was wrong. The second incident was I woke up in the middle of the night and couldn't speak.
So it was almost like you're going through another stroke.
Yes.
Did you think you were going through another stroke?
Yes, I did.
Oh, man.
I was very frightened because I already had a right-sided stroke, and a left-sided stroke I was really concerned about my issues with communication, because through the whole experience, I remember thinking, well, thank God I didn't have a stroke on the left side. And I spoke with my sister, who's my DPOA.
Mm-hmm.
She said, if your stroke was on the left side, I would never have agreed to the surgery. Wow. I said, thank you, because we had discussed before what I'd wanted done for certain events.
Right.
And I said, if I ever had the left-sided stroke, I wouldn't want to survive it, because I was so afraid how difficult it must be to communicate.
Right.
Whether it was receptive or expressive. And so this was my nightmare coming true. And I didn't understand what was happening. I thought, because I knew what I wanted to say, but I couldn't move my mouth. My entire throat felt like jelly. And it felt like there was a power blower going through my mouth and just blowing in. And so my cheeks were shaking and blowing out, and I couldn't form sounds.
And this is all from the anticonvulsant medication, right?
Yes. And then the next day after that, I woke up in the middle of the night, projectile vomiting. I was aspirating, the emesis at the same time. That was also another symptom of my medication.
Well, you mentioned something very important about discussing what you would want done if in case an event was to happen. And you said that was with your sister, correct?
Yes, it was our advance directive that I was very specific about.
That's good. Because, I mean, you were smart to have that. I feel like a lot of people don't have that talk. And you actually went through that with your sister to communicate that with you. So before you had your seizure, you said your seizure was like 5 months after you were discharged.
Yes.
You had, I assume you went to a rehab facility.
Yes, I was admitted into an inpatient rehab facility.
And how long were you there for? And can you describe like how that was compared to being in the hospital?
I was there for 3 months. And when I arrived, they told me that I would be in class. They referred to them as classes,
Mm-hmm.
but that meant my appointments. And my classes were physical therapy, gait therapy, occupational therapy, and speech. And they were all for an hour each. And so they would wake me up by 7 a.m., 8 a.m., and then I wouldn't finish until 5. So it was like a regular job. And that was every single day, including weekends. It was very tiring. And I could see improvement very slowly, so I was very discouraged initially.
Because you're wanting things to happen so quickly.
Yes, I wanted to be discharged within a week. I was still clinging on to the hope that I would go back to my normal life.
So after trying to pull your tubes out, being in a 4-point restraint, seeing Seth Rogen asking for an autograph, right? And going through all this, you wanted to be discharged within a week. So you were like super determined to just get back to a routine. That's what I'm hearing.
Yes, that's all I wanted to do. All I wanted to do was to find my car keys and drive home to the Bay Area. Go back to work.
So was there anything else that stood out that was maybe embarrassing in the hospital, or that you talked about the suppository? And I remember, I'll let you describe it, but you kind of mentioned something before we started recording. You want to elaborate on that?
Because of the suppository, I realized that there were problems with me defecating, and I wasn't doing it, and so they were concerned. And so they started giving me laxatives and stool softeners, and initially I still couldn't go. Part of it was I wasn't eating any solid food. I was only on tube feeding. And so once my speech therapist helped me get back on regular food, I think that helped a lot. Because then I had to poop every day and finally had bowel movements. And every time a neurologist came to round on me in the morning, I would tell her that I was sitting on the commode that day and I had an epic poop, which for me meant I felt really flushed out.
You had to take down your Victoria's Secret mesh panties just to take your epic poops, right?
Yeah. I had to take off my chastity belt. And the interns would come to me and said, "Is it okay if I write in the notes that you said you had an epic poop?" And I said, "Definitely. It's a very accurate description of my experience."
Right. So you mentioned about some of the things that were really tough for you with the teams, with the call bell light, kind of that feeling of losing control. Do you remember anything in the hospital where you're like, wow, like this is what they did great? Like something that just stood out, like this was a good nurse or a good doctor or something that like I received good care?
Particularly my neurologist was wonderful to me because she actually listened to my concerns and regularly came every morning. So I felt that I was really able to discuss my plan of care with her. And that was very rare because every other doctor I wanted to speak to was never free. For example, my neurosurgeon never came by. And so the nurses would page him repeatedly and he still wouldn't come. And I'd look out the hallway and wait for him to walk by. And I'd tell the nurses, please page him and tell him that I'm bleeding out of my ears.
So would you have any advice to nurses out there, not even nurses, but doctors, nurses, or anybody that's taking care of someone that's in your shoes, or anything that you've come out with this on the other side, like this is the advice that I have for others?
I would say to communicate with your patients more, because they want to know about what's happening with them. And when they ask for the doctor, it's mostly to ask about what's happening. And they just want to feel more informed, because it's very confusing what's happening, what is happening to me, and what they want done for me, and what they need from me, because I'd like to participate as well. And so communication, I think, is the most important part, and explaining to the patient what's happening.
So making you feel involved in the process.
Yes, certainly.
So tell me about the family dynamic going through this process.
It was very helpful to have my family there at all times, because they would take care of me. And what they did, for example, are my friends printed every picture I've ever posted on Facebook and made a giant poster. And I remember waking up one day in the hospital, and I opened my eyes and I saw the poster, and I just felt really relieved. And I thought, oh, I really lived a good life, because at some point I just thought, oh, I'm a vegetable. My life is over. I'm going to die now.
Right.
So seeing those just really gave me so much hope, and that I lived a good life. So if anything happened to me, and if in the hospital, it wouldn't be a waste.
It sounds like you went from denial of everything to acceptance.
It took a long time. I think it happened more after my surgery, because then I had a craniectomy.
Mm-hmm.
And after my surgery, they wheeled me into the waiting room, and my family was there, and everyone was crying. And at the time I thought, these people are so weird. There's nothing to worry about. I said, you guys are all losers. Stop crying. And they all laughed and thought, okay, it's still the same Kari. Nothing's wrong with her.
Right.
And then so I made fun of them for crying. And ironically, when I was in rehab, when I first saw myself walking in a mirror, I cried.
And they finally hit you.
Yeah. And I thought, oh, look at all the stuff I've done. Like, I couldn't walk, I couldn't move before. I thought I was a vegetable. And now I can see myself walking. And while it was happening, all my friends started crying. Jamie started crying again.
And Jamie being a really good friend that was there at the time of the stroke, and also there throughout the whole process of being in the hospital.
Yeah, so that was really helpful to know, because they were rooting for me the whole time. And that helped me feel better and come out of the denial that things are going to be okay. Even if I had a stroke, I have people there for me. I've lived a good life, and things can still get better.
And you asked Jamie kind of an important question at some point, right?
Because I was so just filled with love for her and everything she'd done for me. And I looked over to her one day while she was standing next to the bed, and I proposed to her. And she said no.
That sounds like something Jamie would say.
Yeah.
But you knew that she really did love you for being there.
Yes, and I've asked her multiple times, and every single time she's refused me. One time I know she'll say yes, so I'll keep doing it.
You got to keep trying.
Yep.
Just thanks, Jamie. That's a shout out to you.
I love you, Jamie. Will you marry me?
Well, Kari, I just want to say thank you from the bottom of my heart for sharing your story. It takes a lot of courage to be blunt and open and honest and share everything that you've gone through, because a lot of people would not be able to sit in front of that mic and pretty much elaborate on all the issues that you've had. I'm sure there's a lot more, but you've touched on a lot of issues that people are not willing to speak about. And I just want to say thank you.
Well, thank you for having me. I just really wanted to bring awareness for what I felt in my experience, especially for having strokes, especially with women, because every 40 seconds a woman dies from stroke in this country. And I had no idea about that until after my experience. And for example, the whole time I went through this experience, I never considered dying. I just thought everyone is overreacting and that I just had a headache. And I just wanted to sleep, but people kept waking me up. I love you, Jamie. Will you marry me?
Thank you so much for listening to NSR, National Scrubs Radio, with your host, Derek J. For more great content and to stay up to date, visit Facebook and Twitter at Nat Scrubs Radio. We'll catch you next time.